Flash is brought to you by Franco Trading Enterprise. Still, fun papa fee.
You're still watching Prime Morning, and it's still news flash ahead for my colleague Kweku Asante with a very bold call on all of us to rather identify strongly as Ghanaians, foremost as Ghanaians than any other thing, because as you heard him, there's been some raging debate about the names that have been put on some monument and, you know, the language that has been used there, especially in Accra. There's a call that it should rather be the Ga language that should be used, but we must all come to an appreciation of the fact that in Trotro, as you mentioned, you go to the Ashanti region, it is Trotro. Trotro is a Ga word. In Ashanti region, it's still Trotro. In Volta region, it is Trotro. I mean, as he says, Shinkafa is name it, and Hausa name, it's used across the country. All these tongues identify as Ghanaians. It's what makes us rich in our culture, and I think we should uphold it that much and not allow ourselves to be divided by our ethnic affiliations. It's so important. Ethnocentrism is a disease that we must not allow ourselves to be plagued with. We must continue to stay united as one people, cherishing our cultural heritage and promoting it everywhere we can, and that is very important. So, great message. But I don't know, what do you think about this very call? You know, even this message by Kweku Asante. What do you think about the call that, you know, you sort of Akwaba, as it's been used in our airports, it should be changed to Obake? I hope I got it right. It should be changed to Obake, the Ga thing. What do you think about it? Do you think this is the way to go, or you think we should stick with Akwaba and, you know, maybe we can even add Obake to it? We can add Wazer to it. What do you think about this very raging conversation? We'd love to hear from you. Share your thought with me on the WhatsApp line that is on your screen, or will be displayed on your screen. Let's hear from you. What do you make of this debate? Where do you stand on this? All right, where do you stand on this? And let's see how best we can move on from this. This is a nation building. This is how we build our country, and we do it with some of these conversations. But let's bring you up to speed on what's been happening on the various newspapers. And we're going to start with the Daily Graphic. And of course, leading the headline there has to do with the MPP flag bearer raise. And you see there on the front page of the Daily Graphic, partnership key in affordable housing delivery. That's what the developers are saying. They say partnership is key. And as far as housing is concerned, it is also a very, very pressing issue in the country. Housing, how much do you pay for rent? It's a very pressing issue in the country. Then Dr. Mahmoud Bawumia is also on the front page of the Daily Graphic, and his call is that retain me as MPP flag bearer. Retain me as MPP flag bearer. Dr. Mahmoud Bawumia, yesterday after he filed his nomination forms, that's what he said. And a few other stories are leading the headline on the Daily Graphic, and I'll bring you up to speed on some of them. But I've also got the, the Ghanaian Times also, and the Ghanaian Times has got the Greater Accra Regional Minister also there, and she's been making some very strong call on the municipal chief executives, and she says, no excuses, no excuses. With an exclamation mark, that's a very strong word. Greater Accra Regional Minister warns MMDCEs. And you also have Dr. Mahmoud Bawumia there, and strengthening Ghana's country's health system. VIP assures support. And then I'm the most prepared candidate for MPP flag bearer role. Bawumia is also still there making that call. Then from the Daily Graphic, the Ghanaian Times, you go to the Chronicle. The Chronicle still has Dr. Mahmoud Bawumia on the front page. It says, my vision is to expand the economy. That's Dr. Mahmoud Bawumia. My vision is to expand the economy. And you also got Ebo Kwanzaa goes home tomorrow. And you have Edichum also on the front page of the Chronicle. And he says, I will fight poverty. I will fight poverty. That's Edichum. And rescue Ghanaians if elected to lead MPP and subsequently the nation. So Dr. Edichum also with his call there. And then we go to the Overseer newspaper. And on the Overseer newspaper, you can see John Mahama there. And but at the top of it, you see Dr. Edichum, who is promising, I will run a clean, respectful campaign. Edichum pledges as he files nomination. That's the call by Dr. Edichum. And then you also have Ghana's unemployment rate drops slightly. Youth joblessness remains high. And that's according to the Ghana Statistical Service. So, interesting. Then you have John Mahama secures 10,000 bed student hostel for UG in Singapore deals. Interesting. So, that's some really good news. And then you have my focus is on the grassroots, Brian Echampon. And then MPP shamelessly projecting Bawumia as establishment choice. Kennedy Ejapon campaign is accusing the leadership of MPP accordingly. Then Greater Accra Regional Minister Linda Okulu calls MMDCs to order. That is also on the front page of the Overseer newspaper. Now let's go to the New Crusading Guide. The New Crusading Guide, and on the front page of the New Crusading Guide, you see Dr. Mahmoud Bawumia there. You also see Sami Jemfi there with the Gold Board update. And you see GBC workers also on the front page of the New Crusading Guide. But Bawumia says, my vision is to create opportunities for the youth. And then you have GBC workers demand immediate action. Immediate action. In fact, they are calling on the Director General to vacate because they believe that his tenure has expired. His tenure has expired, and they're asking him to leave the Ghana Broadcasting Corporation. Interesting. But then you also have Gold Board suspend Ivanex Gold Enterprise license over illegal pricing. Illegal pricing. Then I'll run a clean campaign. Bawumia assures, and the Nurses Association's worried over rage assault probe. So that is also there. Then I've also got the Daily Gist newspaper here. Daily Gist newspaper. And it says, Mahama throws NDC race open. And then you also see government cuts admissions into colleges of education. It's interesting. And then government kills Galamsey task force. So that's what we understand. The anti-Galamsey task force has been suspended. It has been suspended. Interesting. Then 5 vie for 2028 MPP presidential ticket. And Opon Nkrumah builds schools is there. Then Puaman committee testimonies leak. Interesting. So the committee looking into the Chief Justice, suspended Chief Justice. We understand that some testimonies have leaked in that regard. Interesting development there. So those are some of the newspapers, and that's the what's been happening there. But one of the stories we want to explore has to do with the Nursing Association, who have raised concern about the probe into the rage assault. And that very incident has also called for a bigger conversation on the nurse-patient relationship in our hospitals. The nurse-patient relationship in our hospitals. What is accounting for the seeming, a breakdown in what many believe to be a fine relationship between nurses and patients in our country? Or is it merely a perception that the relationship between nurses and patients has broken down? We want to explore that. And we have on Zoom this morning the secretary of the Nursing Association in Ghana, Mr. Solomon. He is joining us on Zoom. Let me just touch base with him now. So Solomon is the regional secretary of the Greater Accra Ghana Registered Nurses and Midwives Association, Solomon Ajao. Solomon, good morning, and thank you very much for joining us on the show.
Yeah, good morning. And good morning to your cherished listeners.
Wonderful. Solomon, I'm going to come to you very briefly because we're going to talk about the Rich Hospital incident, the probe into it, and expand the conversation to what, is accounting for this seeming breakdown in the relationship between nurses and patients. And if you think it's merely a perception when people say that there is a breakdown. But first of all, I want us to take a closer look at the findings of that probe into the assaults, and we're going to look at it very closely. But we heard from the committee, and the committee, among many other things they found, they say that the nurse in particular who reported to have dislocated her arm did not dislocate her arm. And that, of course, has angered the association. We've seen one of your public relation, one of the officials, Madam Sarah, who has expressed strong dissent to that report. But then we'll share with you, our viewers, some of the key findings, if that's ready, some of the key findings that we have in the PowerPoint slides there. So we'll share with you. But even before we do that, Solomon, let me just touch base with you on what it is that is your concern with the probe that went into that assault.
Okay, thank you. And once again, good morning to Ghanaians. And I think this issue has been one of the topical issues where we've all shown interest as a people, because anything that borders on health is important to everyone. I mean, being old or young, health is a major issue for everyone.
Yeah.
And I must say that we've been following it. We can all tell the cascade of events from when the incident happened on a Sunday night, the following Monday morning, where the minister was sent to visit the Rich Hospital management and the victim, and to ascertain what happened or what actually occurred. In the course of it, the minister was seen hugging and exchanging pleasantries with the guy who assaulted the health workers and who created this whole thing that we are discussing this morning. Unfortunately for us, as a people, as health workers, as nurses and midwives in particular, we were not happy with that act from our minister, because we was like, no, that is not a good sign of assurance. Beyond that, the minister decided to form a committee, and looking at the committee members, 90% of them are working at the Ministry of Health. You can't set a committee to investigate your own self. Why didn't we push in for an independent committee to investigate it? That is one bit of it. But nonetheless, I'm not here to talk about their competences. They are competent in their own right. They are senior colleagues in the profession. So for that matter, you give it to them. But when you have people who have made certain comments and everything, who find themselves on the committee, then you question it. The likes of the Tony Goodman, the PRO for the ministry and all that.
Wait, so you are raising doubts about the findings of the committee. Have you seen the findings of the committee? Are you familiar?
Yes.
So which specific ones are you, against?
So let's put also in context that they were given specific terms of reference or objective for their probe. And within a week, they were to submit their report. If this the minister mandates or sets up a committee and gives terms of reference that they were given for one, the circumstance that led to the alleged delay in providing care to patients that were brought to the emergency department, the event and factors that escalated into an alleged assault of a health professional, the state of security at the hospital at the time of the incident, and the number of nurses and doctors who were on duty at the time of the incident. And in all the conversation, at nowhere had anybody, the victim mentioned about fracture. So even the committee's mandate, they were not to ascertain whether there was a fracture. Nobody has even brought fracture into this conversation. The word that...
But we saw the lady, we saw the lady in the hospital, you know, she had her arm hanging and...
Yeah, we call it sling. We call it a sling.
So what was wrong with the arm? Because the narrative was that there was a fracture.
The event happened and the lady was seen on the event took place on the 17th and the lady was seen on the 18th by a medical officer after she had reported the incident to the police. And let's also say that this issue has a criminal aspect and a civil aspect. So the doctor, the medical officer who is a senior medical officer who attended to this lady, diagnosed her of polycontusion secondary to physical assault. And if you have seen the medical reports making rounds, which I can share with your producers and you can project it on the screen for viewers to appreciate. This is a patient or a health worker who reported to the hospital as a patient and was seen by a medical officer. His information and everything are in the limb system. It's well captured. And this is a legal document that has been sent to the police department. So if a doctor sees a patient and I diagnose her of polycontusion secondary to physical assault, let's do a bit of education here. If we are playing football and I should fall and have my arm removed, that's the joint and its dislocation, we can all appreciate that, the position of the joint is not in place, so the joint is dislocated. But some way, somehow, among ourselves, we can do some maneuvers and the person can have the bone back. Beyond that, we need to position the arm in a certain way to reduce pain. That is why they put the person's hand, the lady's hand, in a sling.
Okay. Now we'll get further into what they call it, what exactly happened to it. But I want us, for the benefit of our viewers, to appreciate the findings by the committee, the specific findings by the committee, because there were a number of issues that they unraveled. All right, we can go through them now if they are ready. If my producers, it's ready, we can go through some of the findings now. And among the findings, we know there were concerns about security, the fact that the hospital did not have sufficient security. There were concerns about some equipment that needed to be, at the, hospital to help with some of these emergency situations. And the fact that even the nurses were, overburdened at the time, and there was some need for restraint. All of these things, we understand, accounted for the chaos that occurred at the hospital. And in fact, the health minister had indicated that he was going to do his part to ensure that what was lacking at the hospital is provided for, and also charged the administration of the hospital to ensure that what they need to do as far as security is concerned, they also do it. Now, I have to also mention that I now also have the the CEO of Accra London Health Centre and Harvard-trained, Accra London Health Centre. She's also a Harvard-trained clinician and also an advocate for health equity, Dr. Vanessa Appiah. She has also joined us via Zoom as we try to unravel how best we can improve the nurse, even hospital-patient relationship, because it's becoming one too many, all right? One too many. So, Doc, good morning. Dr. Vanessa, good morning. And let me just touch base with you. Good morning, and I hope you're doing great.
Great. No, thank you so much. Good morning to you and everyone listening.
Wonderful. We really appreciate your time. So, if the findings is ready now, we really love to go to the findings so we can speak to the specific issues that were raised by the committee and, and explore them. All right, so we'll get into it. But then, Solomon, you shared with me the medical report, and I have seen it now. You talk about exactly what the doctor diagnosed to, as far as the lady is concerned. And I have seen it now. I have seen the details. Interesting, really interesting details based on the what the doctor has put out in his report. But Dr. Vanessa, I'm sure you follow this closely. What is your reaction to this? I mean, when you first saw the incident, what did you make of it?
I thought it was complex. First of all, you never want to see any health worker working there to care for people, to be exposed and to any violence at all. So, that is a non-negotiable. But when you take a step back, when anything like this happens in any setting, and particularly health, you do like a root cause analysis. You're trying to understand what was involved that led to this incident. And it's multifactorial, isn't it, as we are going through today. So there's a frustration of the patient and the wider patients of what is happening within the hospital, what they feel is lacking and what they're not getting. And then there's also, and that relates to the wider system in terms of infrastructure, lack of resources, lack of capacity. And then also it's related to the medical and nursing staff there, of how they are supported and how they are trained to handle situations like this. So I think what happened was a melting pot of a number of issues that need to be addressed. But fundamentally, no one wants to see anyone that comes day to day to care for people to be exposed in this way.
Interesting. I mean, you make very fine points there about the fact that we should not allow our nurses to go through situations like this. But one of the things some of the patients also, the concern some of the patients raise is the fact that, some of them come there injured, and understandably, they'll feel very frustrated when they're not being attended to. I mean, just give us a little knowledge. What happens at your facility when somebody comes into the facility, with an emergency situation? How is it handled at your facility?
So all of this, just to say, is about managing patient expectation as well, and clear communication and transparency about the process. So for my facility, and mine is a private facility as well, so just acknowledging that. So someone will come in, they will be immediately met by someone from the care coordination team. They will then be sent to triage to be assessed to see what needs they require, and then they will see the appropriate healthcare professional, and that is all kind of a swift, smooth process. But we really have to recognize that within that, it's important that you explain to the patient what is going to happen and why it's going to happen. And I think in the situations that we're hearing about is that there is also that lack of explanation of it, saying that we want to see you, we're really busy, we're coming to you, and recognizing as well that, when you're unwell, we're all stressed. You never see our best selves when we're unwell. That's it. And so there is a way, I believe, of managing and communicating to support people through that. But we also have to recognize that when you are stressed, when you don't have enough staff and your patient to nurse ratio is 1 to 20, having that time and opportunity to have those conversations is difficult. So it goes both ways. But as I said, in my facility, being where it's set, there is that flow from coordination, review, triage, and being reviewed by the appropriate medical professional.
Solomon, I mean, this is in a typical private hospital. In the case of Dr. Vanessa's hospital, that's what happens. Now, bring us up to speed. In a typical public health hospital, when we get there with an emergency, what is the protocol like?
Very well. I think in the course of responding to you, Dr. Apia mentioned triage. So in a typical government hospital, in medical practice and nursing practice, we all have to appreciate that at emergency, it is not first come, first serve that we use. We have to triage you. We have to sort out the cases that are rushed to the emergency. So that we attend to you based on, let me use this word, those who are about dying. I mean, those who need agency, those who need that immediate care. So at any government institution, we have a triage unit before you are being directed to the next point of care. And at the triage, we use color coding. We have red, we have orange, we have yellow, we have green, and we have blue. In other jurisdictions, they will use black. But when you are triaged to be red, that means whatever is happening, everybody has to stop and you need immediate care. such as head injury and all those things. If you are triaged and you get the color coding about orange, then we'll give you about 10 minutes. We can work around something, and within 10 minutes, you need to be attended to. If it's yellow, you can wait to about an hour, 60 minutes. But when it's green, you'll be redirected to go to the OPD to join the queue to be seen by a physician or a clinician. And at the OPD, it's first come, first serve. So, and blue, I mean, basically, you are no more. You passed on or you are dead. So, before anyone attends to a client who have been rushed to emergency, you need to assess physical assessment, and you need to do your triaging to meet certain criteria, and you know what action you should take. Some need immediate action. So that when you activate the emergency team, then quickly they will respond. In the case of Ridge is a tertiary hospital. It's a referral facility. And for that matter, every other hospital in Accra refers to Ridge. So you can just picture that pressure that will be at the emergency department. There will not be luxury for anybody to be playing around or be toiling around with patients. No. So at Ridge Emergency Department, their triage unit is very strong and efficient. So even before you refer a case, let's say from Dr. Pierre's place, we will need to confirm that whether we have bed based on the communication or the information you will give to us. We need to confirm whether we have bed available to receive such a patient before we will give you the green light that refer the patient.
So Solomon, let me give you a scenario, all right? Let me give you a scenario. So there's an emergency where one person has had, maybe there's an accident. One person has had the hand crushed, viewer discretion, I beg your pardon, but just to create a scenario for people. But someone is bleeding on the arm. Another person comes and they have an issue, maybe some bleeding on the head, all right? Another person also comes, he doesn't know what is really wrong with him, but he can feel that he's uncomfortable. If you have these three scenarios, who is going to be attended to first?
So, well, that's my clinical judgment. Doctor to me add on. But for me, I'll give priority to the one with the head injury. I'll give priority to the one with the head injury because, you see, whatever we do, our actions and movements, our sleep and our awakeness and even talking and everything, there's that part of the brain that controls it. So with that part, you can't be sure what has affected the brain, and you need to do a head CT scan and everything. So all our attention after my triaging and everything, then I'll look at the one with the head injury. If someone is unconscious and everything, you can also tell. But the one with the broken arm is seated. Probably after assessment, there's no bleeding. There's no obvious bleeding. There's visible fracture of the bone. So you have to position it and give some pain medication to reduce the pain whilst the patient waits for an X-ray or a CT scan to ascertain the extent of damage to the bone before you can do certain actions. You can't just apply a cast or a POP once you can physically see that the hand is broken. You have to understand the extent of damage, whether some tissues or muscles are involved in everything. So with me, if I'm to do my assessment, my first priority will go to the one with the head injury.
Okay, great. Doc, let me bring you in with the same scenario. Will you also prioritize the one with the head injury, and then who comes next?
I think my colleague was very clear in the approach, and I completely agree. So, and I think one of the things just to be here to say is that you've given a scenario off the top of your head, but there are always so many other factors underneath each patient that we need to assess within that triage to formalize that decision. But when you are hearing it as it is, yes, you would be thinking going first to the head injury. You're then thinking about the person with the significant crush injury and making sure that you need to intervene there. But you're also recognizing that you haven't forgotten that patient that feels uncomfortable, because the term uncomfortable is such a vague term, and that could be anything. So one person could say they're uncomfortable with severe pain, but they're saying it's uncomfortable, and that could mean an acute surgical emergency. And then someone has just got a bit of a scratch on their back, and then that is uncomfortable. So when we're triaging as well, we're not simplifying it. You're recognizing that patients present in their complexity. But I want to emphasize as well two things, is that it's communication, as I said earlier, to say that making sure that other people that are around understand that we are attending to someone because we feel that there's kind of more severe severity at present, but we haven't forgotten about you. And also, if you do have the right resources in place, you can have one person going to a senior person, and then you're task shifting with other people within the department to review the other people, to put them in as much comfort as possible before the next senior person will come. But if you don't have that infrastructure and support, you can't do things in the most optimal way, I have to say.
Interesting. I want us to go back to the findings of the committee into that Rich incident, because there are a few things that came out of it, all right, having to do with equipment in the hospital and a few other things that I want you to touch on, and why it is important that we have all of those things in place to aid, emergency care in our hospitals. So if the team is ready with that report, we can go into it at this point. And I think very concerning for me is the absence of some equipment that the committee, identified to be absent in the hospital, which also contributed to the situation. Now, when you go to some of the findings in relation to the specific terms of reference that was given to them, they were asked to look at the circumstance that led to the alleged delay in providing care to the patient brought in an emergency. And they said that the committee found that there was no delay in attending to the patient with suspected head injury, who was the reason behind the agitation, Mr. Ralph Williams, and the motorbike riders, that he had been abandoned. However, it was found that all the diagnostic imaging equipment, X-ray, CT scan, MRI at the ED were faulty and not functional. Thus, all images requested at the ED ought to be done outside of the hospital, and this has been contributing factor to delay in disposition form or initiation of definitive care. Doc, I wanted to touch on this. How important is an X-ray, CT scan, MRI at the emergency department? So much that it was non-functioning at the Rich Hospital, which is a tertiary institution, for which reason, and in an emergency situation, they had to run some of these tests outside of the hospital, and they say this was part of the reason why there was a delay. How important are this equipment, and how worrying is it that for a tertiary institution we don't have these at the Rich Hospital?
Thank you. I think it's extremely concerning. Diagnostics are the crux of medical care. And so we can listen to a patient, we can get their history, and we can examine them, but we use diagnostics to make the most appropriate judgments. And so not having diagnostics in an emergency facility is really concerning. And I think what my colleague Solomon said earlier was that it is a tertiary hospital. So people are coming from other services to this facility expecting a certain level of care and intervention on site. And so they come in an acute emergency, and then they're having to go outside and be transported. And again, there's another conversation about how safely people are transported from the tertiary service to another diagnostic center. And then they need to have the intervention, come back, and then be reviewed. And so that, even as I'm describing it, you can just imagine the time involved is concerning, because in acute emergencies, time is of the essence. So I think it is crucial here that the conversations need to focus on what do we need to do now. And one clear thing is that if there are equipment that is faulty, those need to be rectified, and also having a long-term plan in the future about maintenance as well. So this is a much broader conversation, but it is deeply concerning.
Yeah, I mean, Solomon, let me bring you in, because your association, of course, you've got nurses scattered across many hospitals in the country, and I'm curious, if the Rich Hospital, we're talking about the Rich Hospital, a tertiary institution, had some of these equipment non-functioning, then one can imagine the situation in many other hospitals across the country. Are you privy to the condition of some of our hospitals in the country and the extent to which it's equally affecting emergency care? Solomon?
Yes. just as Dr. Appiah stated, diagnostics help in treatment or the urgent treatment that you have to give to our patients. But the issue, like she stated, we have to look at it in the broader context. When you talk about these equipment, they are very vital in our healthcare delivery system. And in a broader context, we would have preferred it to be at certain levels of the healthcare delivery at the district facilities that you don't necessarily have to come to reach before you get a CT scan done for your patients or your clients. And of course, it's part of the things that we've been speaking about. And when I take you a bit back, about 2 or 3 months ago, we were talking about condition of service and everything. I mean, what became topical in our conversation was the remuneration. Everybody was looking at the monetary aspect. But when you talk about conditions of service, it all encompasses your workplace safety, the equipment you need to work with, the people that you have to work with. In the report, they stated that out of 88 nurses that were supposed to be at post, it's only 54 we have. And they use the word they vacated post as if they themselves left. No, they have left the country for greener pastures. They've gone to a country where their work is appreciated, they are valued, the remuneration is better. You understand? So, and you see, beyond the monetary aspect, you have the knowledge, you have the skills, but sometimes the equipment to work with is not there. And you have a patient dying and you look helpless and as if you don't know what you are about. Imagine at the time they brought a patient and the CT scan was working. They would have done the immediate diagnosis and doctor would have given the prescribed treatment and the nurses will follow through with it. But here we are, it was faulty, non-functioning, as to even transport the patient out of the facility to a nearby CT scan. The patient will go and join a queue. It will take about an hour or two before. And in emergency care, time is of essence. Every minute counts. Once they bring you to the ER or the ED, every minute counts. Your life depends on our actions and inactions. And our actions and inactions encompass with the equipment and the team that will work together. So if the team is prepared and the logistics are not available, we become helpless. So it's a campaign that we've been talking about that improve upon our conditions of service. When you hear nurses or any union, being a GMA, GOSPA or GRNMA, talking about condition of service, it's not only about money. It's about the team, about the things that we are all working with. If the place is, if I come to work and there's no chair for me to sit on, there's no computers to work with, I mean, that is the list of the things.
Interesting,
but the clinical
Solomon.
Judgment and the,
Solomon, I want us, you made the point about the number of nurses and doctors at the facility, and it's striking what the committee found at the Rich Hospital. And sometimes I keep emphasizing that this is the Rich Hospital. This is a tertiary institution, which ordinarily, should be the best in the country, all right? And sometimes I try to narrow it down. If this is the situation at Rich Hospital, I can imagine the situation at some of the district hospitals, not even in Accra, but in the hinterlands. You could tell that it's dark. We are in some crisis that we are probably not talking about. And Dr. Vanessa, just listen to this closely. The committee found that the number of staff on duty per shift in the hospital is woefully inadequate. Emphasis on woefully. They said the number of medical officers in the month of August is 1 per shift. Thus, 3 officers per day and 1 emergency specialist per day. Any other doctors visit the ED as a team on call per day trauma. Then they say a total of 7 medical officers and 2 specialists were available for duty in August at the emergency room permanently. Example, out of 88 nursing staff who routinely work at the emergency department every month, only 54 are currently at post, with about 34 already vacated posts without replacement. This has brought extreme shortage in the number of nursing staff at the emergency, at the emergency. Clearly, there is a staffing issue, there is an equipment issue, and that is probably leaving the country's healthcare system in crisis. This is a huge problem, isn't it, Dr. Vanessa?
Definitely. I think that the staffing numbers that you've said are really, really stark, and it really deeply shows the issues that we're facing in Ghana. And again, picking up on some of the conversations earlier, the numbers, when we're saying, vacated and they left, etc., there's a reason why people are leaving. And there's a reason why people don't want to stay in their positions. And it's multi-layered. So yes, it is about pay, but I think as Solomon has said, it's the wider issue. It is about how you feel valued, how you feel that when you go to work, that you have got somewhere to put your bag, where you have got somewhere to go and eat during lunch, that you have got the resources that you need to treat people in the way that you've been trained to treat people. But if you constantly attend work and you feel that you're not doing your best, as a healthcare professional, that is deeply troubling. And that really affects your quality of life, and you question your career choices. And I think that also, there is, it's a whole pipeline. So yes, you've got people vacating, but we have to think also what's happening upstream as well in our recruitment, in our education at the different health schools, whether it's nursing, whether it's medical, and all the allied health professionals, to make sure that we have enough numbers going in and being supported to get the roles that need to be filled. But for me, the other thing as well is that healthcare, one hospital is not the only problem. Healthcare is a system of care. And so someone like me that's working in a private institution, I do not function independently. And I function in collaboration with other facilities in my area. I refer there, I discuss it with colleagues there, and I also refer patients to the public hospitals as well. That's how healthcare should function. And we also need to think about how we collaborate with one another, how we communicate with one another. So if some places are under-resourced, how do we let other services know in the area? How can you support us? How can we manage things in the interim? But those conversations are not there enough. Our pathways between each other are not robust enough, I feel. And then we also need to support the staffing structure that we have, review the task shifting within our services, and also make the job attractive so that people will want to come into these professions.
And one of the things that, Dr. Vanessa, I think we are also seeing is the fact that this is a public hospital. A number of these nurses are not just leaving the public hospital, traveling abroad, as we know some are doing, but some of them are also leaving the public hospital to the private hospitals. All right, you're leaving the public hospitals to the private hospital. And I'm just curious, in your case, for instance, and we've got at least visuals of your hospital on the screen at the moment. I mean, what is it that you are doing which is attracting nurses from the public sector into your space? Because it does seem to suggest that the private sector is doing something better compared to the public sector. Yet, ordinarily, you will appreciate that the public sector ordinarily has more funds. The state has more funds to take care of people compared to the private sector. But then the nurses are moving there. What are you doing, for instance, in your hospital, which is making it attractive for nurses to come there?
I think it's different things, but one thing I will say is different versus better. What we provide in the aesthetics, it is different. And I'm always cautious of the word better because I don't want to minimize what is happening elsewhere. But I do think, number one, what's interesting is that the staff that I have actually were at home. They didn't actually, some people didn't have jobs. So they were waiting for jobs. So it's not like they left the public system to come. Some people, they hadn't been recruited as yet. So that's number one. Number two, I was trained in the UK and I made a conscious decision that I wanted to come to Ghana. And I wanted to come to Ghana to contribute to the infrastructure of the healthcare system within Ghana. But so I bring my experiences from the UK and I bring the fact that your environment is important. It's important for the patients that you see. When you're saying that you're creating a health and wellness hub, you have to feel that you're in a space that you trust, that you feel comfortable and confident in. And And in the same way, for my staff, I create a space that they feel comfortable and confident in, that they can deliver the care that they want to deliver. I think also, I believe in staff development. The staff that I have now, very fortunate to have, and I'm thankful to have them, but they may not be with me all the time. Part of my role is to support them to develop and achieve what they are meant to achieve in the future, whether with me or with other facilities.
Interesting. Solomon, if I can just bring Solomon on briefly. Solomon, I mean, you just had the case of the private hospital which Dr. Vanessa is heading, and we are familiar with some of the issues that the nurses in the public sector are facing. I mean, just recently, about a month or two ago, you put the whole country in disarray because of the strike you threatened due to some allowances, etc. But fundamentally, tell me, what is it that the state will need to do to keep your colleagues, to keep them motivated, to keep them working, giving their all? What do you need to keep you motivated and working and stop vacating your post, as is reported at the Ridge Hospital?
Thank you. Maybe I should tell Dr. Appiah that from here I'll be bringing my application letter, so that I'll be the first person. I'll be the first person to vacate post.
I think we want you to stay in the hospital. We need you there.
Because no. I want to work in a conducive environment. Look at how appealing in the places. You are assured of safety. You are assured of a conducive environment. That's the word. For me, that's the word for me. And when you talk about people vacating, like she rightly said, there are push and pull factors. There are things that we need to do as a country to retain our people. Like I mentioned earlier, I've had opportunities, the third opportunity to move out of the country, and people will call you, the way you work, the way you are intelligent, if you are out there, you'll be making a lot of money. And I tell them that it's not just about the money. If I should get the right equipment and the system to work with, I'm happy to be in my home country. At least I should be able to walk out at 10 p.m. to buy kelewele or something, and not be chased in someone's country and be asking, where's your ID card? Where's your... No. I just want to have that peace of mind. So if the environment is not conducive for our people, trust me, people are running to some countries that when you hear them, that necessary Kuwait and Taiwan to go and work, then I'm like, what do you actually need?
Where you have colleagues moving from Ghana to Taiwan to go and work?
Yeah, Taiwan, Kuwait, Saudi Arabia. As for US and Canada, it's difficult now. But they are just moving to any of the European countries and the Arab countries just to make it. They'll tell you that when you go there, at least the systems are there and your work is appreciated in terms of the salary level. If I'm here and my salary is not even up to $800 or $600, $500 a month, and a colleague is taking $3,500 a month, what do you think I'll do? I'll just move. You understand? So beyond the cash aspect, we are also appealing that we, as Ghanaians, we should add our voices to the campaign to have a better system. Because I work in a district facility. I was just about saying, a whole department was closed down because of staff leaving posts. Not in just my facility alone. Other facilities, we go to government hospitals in the eastern regions and everything. We get reports per my role. So we get reports. In Accra, there are a lot of facilities that there are shortages, not because they are on annual leave or something. They've traveled. They've left the department. So the management are forced to close it down. Then again, that how do we manage our resources? The revenue generation. Do we prioritize how we want to spend it? In the private sector, they will prioritize what they are supposed to spend on. But everybody is looking up to government. We have managers, we have management team, we generate funds and everything. What are the resources, the money being used for?
Wait, you mean the revenue generators at the hospitals, right?
Exactly. Exactly. If a government builds a hospital and gives you a bed, and you are waiting for the government to bring you another bed in 10 years or in 20 years' time. But at the private hospital, they will tell you, I've worked in the private quasi facility in a private hospital as locum nurse. And they'll tell you that what your output will bring enough money, and that will be depend on the amount of money you'll be paid with. So your input will determine your output. And with that one, they provide all the facilities for me. I go on night duty at the private hospital. I don't need to transport my clients out of the facility. They'll do the CT scan and MRI that night for us. and we'll attend to the person. If I need to do an ECG, I don't need a doctor to come. As a nurse, I'll do my own ECG and communicate it with the doctor, and we'll start our treatment.
I mean, so
but in a government facility, a common ECG, you must be referred outside to go and take an ECG.
I mean, Solomon, moving on though, what do you think can be done? I'm sure, even though we have concerns about equipment, etc., there are still some attitudinal changes that are required of some of the nurses to improve the patient relationship. I mean, if you want to talk to some of your colleague nurses, and even you want to extend it to some patient, what attitudinal changes do you think needs to be encouraged to improve the patient-nurse relationship in our hospitals?
Yeah, so fundamental, one of the key things that we have to work at is communication. And how to, I always say that it's not what you are saying, but it's how you say it. So how you communicate to someone, how you explain the issues at hand will give them that assurance that, of course, you may want to attend to A, but she is C, but it's based on this. And so communication is key. And that is what we are collaborating with the Nursing and Midwifery Council, which is a regulatory body. And we're also collaborating with the schools to help with educating or emphasizing on that aspect. Again, in terms of CPDs, that's continuous professional development, we organize some trainings, webinars to educate our colleagues and members on customer care. In my facility, I serve as a training coordinator as well. And it's one of the key things that we are working on. Communication. Customer care is the number one thing that every facility, being it at the CHIPS compound, at the district hospital, at the regional hospital, or even the teaching hospital.
Yeah, you're emphasizing on that. You are doing a lot of training on that. Solomon, really appreciate your time this morning. Doc, same question to you. What do you think you will encourage both patients and nurses to do to improve the customer relationship?
I think I have to really echo Solomon's comments about communication. Communication can change, a situation dramatically. The way that you let me know that I'm waiting, that I may need to wait 4 hours, the way that you communicate that to me can really transform my experience within a service. And so I think emphasizing the need for heightened communication skills support and knowing that it's at all levels. I have to say this. We're talking with the nursing teams because of what's happened, but it is at all levels within healthcare.
Yeah, because Doc, sometimes Doc, let me just chip this in. Sometimes there are patients who go to the hospital and they said, I've been sitting here, nobody has told me anything, and I'm just sitting here. Exactly. Nobody has told me anything, and I've been here for 2 hours, and you ask a nurse what's happening, nobody's saying anything to you, and it's very frustrating sometimes.
Very frustrating. And I think that it's from your reception and admin to your nursing team, to people that are walking around. I say to my team, anyone that is within the space, you have a responsibility to interact with the patients there, even with a smile, let them know that they're seen, and also communicate what's happening within the rider service. But in a much bigger setting like Ridge Hospital, that needs to be embedded from all levels of workers to have that communication. And on top of that, it's also that with our patients as well, we need to do more, I believe, in terms of patient empowerment and advocacy, to, for patients to feel more comfortable to communicate what is going on, what they need, to be part of service design within healthcare.
Right.
So there's an element of both from us as professionals and also supporting patients to be more involved in the discussion so that we create the system that works for everyone. And I think that's the focus, and we need to be very intentional with that.
All right, Doc, thank you very much for your time this morning. Solomon, I really appreciate your time, and to all of you, who are also joining the conversation, really appreciate. But we would love to continue the conversation with you watching us. What is your experience? What has been your experience at the hospitals? The last time you visited the hospital, what was your experience? And you can mention some of the hospitals that treated you well and the others who did not treat you well. We want to raise the concern so that we can get into it. So tell us, what is your experience? And what do you think needs to be done to improve the relationship between nurses and patients as we develop this conversation? So, Doc, thank you very much. And of course, Doc is at the, the beautiful hospital we saw on our screens there very shortly, the what do you call it, London, Accra, is it Accra, London, what do you call it, health facility. The Accra London Health Centre is at Cantonment, beautiful facility. And of course, we do recommend it to you also. And Solomon Apia is the secretary of the Greater Accra Regional Association of Nurses. So really appreciate your time. Well, the conversation is going to continue. I just want to read some of your messages that have come through now. I understand we've got some messages on Facebook and some messages on WhatsApp also. We're going to have another health conversation about sickle cell. So, but let me just get some of your comments. Guys, if the comments are ready, can we do the comments now? All right, let me check on Facebook now, the comments we have on Facebook at the moment. So I understand we have some comments now on Facebook. And you could see here, someone said, okay, talking about, what do you call it? Talking about the MPP aspirants' position from news, our news stories. It says, why are other aspirants in the MPP always attacking Dr. Bawumia? If it were not for jealousy and greed, no one should have contested against Bawumia. All right, this one said, all those few bad nuts in the noble nursing profession dragging the name of the profession into disrepute and public ridicule have been exposed. Interesting. Someone says, Solomon is aggravating our anger this morning. It's better he stop. Interesting. Well, we are trying to make it better. Yahaya says, we always complain that there are no jobs, but when opportunities are given to us, we fail to act professionally. Interesting. Interesting. So you can see those are some of the comments. They said government should supply all things needed, talking about the equipment that are lacking. But understand there are some comments also on WhatsApp. We're going to have that on the screen very shortly and see what you've been saying about what we need to do to improve the patient and nurse relationship in our hospitals, the customer care at our hospitals. What do we need to improve it? All right. We're going to bring you that comment on WhatsApp very shortly, but keep the messages coming. Keep the messages coming. We want to hear from you. We want to hear from you. Experiences at the hospitals and what you identify needs to improve to ensure that when you go to the hospital, you have a good experience. You have a good experience. You have a good experience. Okay. So as I mentioned, we're going to have that conversation on sickle cell very shortly. And then we will get into some other issues. We have also Perez music coming in today. We're going to have some wonderful melodies coming up. But then some messages from WhatsApp. Let me just go through them briefly. This one says, good morning. Investigating an incident of assault on a nurse, it's crucial to ensure a fair and thorough process. This includes forming a committee with representation from the institution where the incident occurred. Key stakeholders such as the assaulted nurse and the doctor who examined her should be invited to share their account and provide relevant documentation like medical reports. Without their input, any conclusions drawn by the committee may be premature and potentially flawed. A thorough investigation requires considering all relevant perspectives and evidences. That's very profound, really, really profound message there on the health situation. Okay, so fundamentally, I think that's okay. We have one here. Let me see. Good morning, my brother. It is important we stop playing politics with our healthcare system in this country. It is clear that those calling themselves leaders of our registered nurses associations are playing politics with our healthcare system in the country, and that is a fact. My brother, according to the Ministry of Health, the contract was signed with a company to supply those equipment to the Rich Hospital, and the government will be giving 20% while the company takes 80%. As we speak, those equipment have not been supplied, but the hospital keeps on paying the 80%. But I'm happy to hear the current management has stopped paying the monies. Interesting. So those are some comments. And there was one also on our Kwaba conversation. It says, it's a great call for us to guard the peace we have in Ghana. I'm not an account, but I think Akwaba is for all Ghanaians. That said, I understand why smaller tribe groups are standing up, because the larger tribal groups are pushing it too far. Okay, well, we'll just keep it like that and not get too much into it. Okay, anyway, so those are some comments that have come through now. We want you to keep your comments coming through, and let's get into the issues as they do unfold. All right,